Hello, everyone. It has been a minute since I went live, but we are apparently live. All right, here we go. So tonight we are doing an Instagram live to talk about Alzheimer's and dementia. I'm going to be hosting here Dr. James Galvin, who has an incredibly impressive resume. Dr. Galvin's not only a professor of neurology at the University of Miami School of Medicine, but he's also the director of the Comprehensive Center for Brain Health. Forgive me, I have his information here beyond the screen here because there's so much to list because he's such an impressive person. He's also the chief of the Division of Cognitive Neurology and also the director of the Lewy Body Dementia Research Center of Excellence. So obviously an incredible resource for those looking to learn about Alzheimer's and dementia. And we're going to have him for about 10 minutes, ask a couple of questions, and I'm going to have give you all an opportunity to also ask him some questions. I'm just going to get him in here. Forgive me for some troubleshooting, but please, in the meantime, definitely consider what questions you may have in advance. All right, there's Dr. Galvin. How are you doing, Dr. Galvin?
Good. How are you?
Excellent. I appreciate you joining me here tonight. We want to be expeditious here and quick, so I want to jump right in and get to an important question. Earlier this week, I posted a video about the importance of being diagnosed early for Alzheimer's. And so I want to ask you, why is this important? Why is it important to be diagnosed early? And, a comment that I saw people asking, would love to pose this to you is there a particular window that we should be focusing on as far as being screened or looking for an early diagnosis?
Well, I think for any medical problem, the earlier we can recognize it, the more we can do for people. It's never too early, it's never too late, but it's better to be too early than to be too late, right? So I think that's really key. If we can get an early diagnosis, there are many things we can do. One, the patient can participate in their care plan, right? So while they may have a little bit of a memory problem, they can tell you exactly what they want to do and what they don't want, and you can incorporate that into so it could be a shared decision-making process. We can assist with advanced care planning if none of that is already done, or we can update those plans so they're up to date and accurate. We have symptomatic medicines that reduce some of the symptoms. And in today's world, we have some disease-modifying medicines that are really only indicated for the early stages. So if the person is a candidate for those medicines, the early diagnosis will allow that person to get treated.
Interesting. So yeah, I'd love to talk more about those medications. Obviously, I think when people hear about, okay, you get diagnosed, there's essentially, there's obviously several benefits to being diagnosed, but the first one that comes to most people's mind is medication. You become eligible for a frontline treatment that can help you. In the last few years, there have been a few new treatments hitting the market, and please, fill people in, help update people on what's new with these treatments and kind of, what we know about them, maybe how they work, whatever you feel is important to share.
Sure. So the newer medicines are immunotherapies. They're monoclonal antibodies. They're infusions that work against the amyloid protein. This is the protein that makes up the Alzheimer plaque in the brain. And so they are infused. The one medicine that's currently in the market, lecanemab or Leqembi, is an every 2-week infusion. There was recently another medicine approved, but it's not available in the market yet. It'll be a little bit while before it's available generally for treatment. That's called donanemab or Kisunla. And so these medicines help remove the amyloid plaque from the brain. People get cognitive benefits. They have a slowing of the rate of change and progression, somewhere between a 25 to 40% slowing, depending on what type of measure you're using. All medicines do have side effects. So there are side effects associated with the medications, and not everybody who has disease will be eligible. So it's important to get an early diagnosis, and then if a candidate for the medication, to do the workup to make sure it's the right choice for you as the patient.
You mentioned earlier, like a window of eligibility for early onset or early in the disease progression. What can you just define that a little bit? Like, what does that look like for patients
So the people
looking for?
who would be eligible for these medications are individuals. First, we have to demonstrate that they actually have Alzheimer's disease. So we have to do a biomarker to establish that there's amyloid in the brain. We have to do some other tests to look for potential reasons why someone would be excluded from taking the medicine. And then we have to stage the person. So it's the mild cognitive impairment stage, that is mild memory changes, but people are still pretty independent, or the mild stage of Alzheimer's disease. So in the earliest stages, people who have moderate or severe disease are not candidates for these medications, and people who have subjective complaints without objective findings are not eligible. So you can be, you could be too good, or you can be too impaired. So it's a window right now that we have to treat people. So that's why it's important to get evaluated, make sure we know what it is, get correct staging, and then have that discussion as to whether you're a candidate for therapy and if you want to go ahead and get treated.
Awesome. So when people want to go get screened, I think a lot of people can have complained or expressed, concern with the fact that a lot of specialists are either they're really far away or they have, a huge backup of patients trying to get in. What do you recommend for people who are looking to get screened but are actually just running into a wall?
Right. So any clinician can screen people for Alzheimer's disease. So your primary care doctor, a nurse practitioner, a physician assistant, a licensed clinical social worker, a physical therapist, an occupational therapist, any clinician that you're seeing is capable of doing screening. And then identifying people who are eligible for treatment. A lot of those tests can be done in the primary care setting. Probably most treatment at this point is being done in the neurology setting because the expertise in monitoring the response to medication and the side effect management is probably really in the purview of neurologists and to some extent geriatricians and geriatric psychiatrists, but mostly neurologists. But the screening part can be done by many different individuals. And so you should talk with your family doctor if you think you have some concerns, and they can start the ball rolling and get a lot of it done before you need to see the memory care specialist.
Okay, so the screening can be done by essentially any medical professional, but what about getting a second or third opinion? Is that advisable? What are your thoughts on that?
Well, I think if you're interested in a second opinion, that makes sense to do that. I think if you start at the primary care setting and you're thinking about doing one of these disease-modifying medicines, you're going to make it to secondary care, and so that clinician is going to do another assessment. So almost everybody is getting a second opinion. I think, if you're concerned that either they're not listening to you or that they're not giving you the answers you need, then seeing a specialist makes sense. A lot of states have Alzheimer plans, and so there's a lot of state-funded memory disorder centers. There are also, all the medical schools will have memory disorder centers, and there are a lot of clinical trial centers that'll do free screening. And so there's lots of options to get that second or third opinion to give you, the answers that you need and get to the point where you can initialize doing therapies.
So a couple of good questions have come through. I want to pick the most recent one. It's a good question. Wouldn't brain scans be the best thing to do?
So brain scans are part of the workup. So for people who are getting diagnosed, everybody needs a neuro image, preferably an MRI. It's going to give us the most information. If we can't get an MRI, then a CAT scan can help, but it doesn't give us as much information. And then once we establish that we think it's Alzheimer's disease, we need to establish that there's amyloid, and that could be done with a PET scan, which is a nuclear medicine scan. One thing I will mention is that in order to be treated with these new medicines, a person has to be able to do an MRI because some of the side effects from the medicines can only be seen on MRI. They cannot be seen on CAT scan. So inability to do an MRI would be an exclusion from getting treated with these new medicines.
No. Good to know. I want to sneak in one more question. Someone asked, what about stubborn parents that would not voluntarily go to a doctor, or grandparents? Are there any methods or approaches that might help get someone into a screening?
So, I think this is a common question, and I will give the best answer I can. So, first, try to reason with the person, and if that's not the case, then appeal to them. Your grandson or granddaughter would really want you to take the best care of yourself. Another option is to go with together. So the person who doesn't have a memory problem could say to them, "Let's do this together." Um, you could appeal to their altruism, and so there are a lot of research projects that people can participate in. And so you could say, well, there's nothing wrong with you, but think about how you can help the world. So there's lots of different approaches that someone can take, and they all may work different in different people, depending on their position. The worst thing you want to do is don't be sneaky. Don't take someone there that they're not prepared to do that, because one, they'll be angry, and two, they won't participate in the exam very well. And so it's very difficult for the doctor to help you make a diagnosis. So you really need to get them to go there, but you can get them there by lots of different sort of paths. All roads lead to Rome, right? So any path you can get to the specialist and get tested is a good path.
Yeah. So, okay, sorry, we're over time, but one more question, because
Sure.
I'm sure this is a passion of yours, and this is the most probably maybe important question. What can someone do as they age to reduce their risk of Alzheimer's and sustain their cognitive functions?
So we know there are a bunch of things that make us at higher risk. There are things we cannot modify. Age is the greatest single risk factor. Obviously, our genes and our family history are risk factors. We can't change those things. But of the things that we have some control over, about 45% of the total risk of getting Alzheimer's disease is controllable by us, right? So better control of our medical conditions, things like heart disease, high blood pressure, high cholesterol, diabetes, obesity. These things increase our risk. Physical inactivity, hearing loss, air pollution, social isolation, these things increase our risk of Alzheimer's disease. So what we could do to build a better brain as we age is to stay physically active, mentally active, physically active, socially active, eat a healthy diet, be mindful, and stay socially engaged. These are things that are common sense type of things for which we have direct control over. It can help us build a better brain as we get older.
Awesome. Well, it's funny because when we talk about brain health and good habits and bad habits, the same things commonly come up. Exercise, diet, sleep, socialization, and it's funny, you don't often hear the kind of off the beaten path things of particular supplements, things that you hear a lot on social media. When we talk about like what has been validated through multiple meta-analyses, it always comes back to the basics. So it's important to focus on those and just hammer those down however you best can. But Dr. Galvin, I want to thank you so much for your time and your expertise. Thank you everyone for sharing your questions, and I also want to thank MedIQ. This session was developed by MedIQ and made possible through an educational grant from Eisai. But Dr. Galvin, thank you so much again. And of course, please, if you have more questions, you may leave them in the comments. I will post this into my feed, and we can answer some more questions in there. So thank you, everyone, and good night.
Good night. Thank you.